Suboxone for opioid use disorder. Various ways of getting clean have been advertised that are either difficult to keep up with or unrealistic. The only variable at the top of everyone's list is that treatment should not be impossible to get. Getting clean and steering away from the risk of relapse and overdose can provide a cornucopia of advantages for recovering addicts, and it should be as simple as possible. Too many people struggling with addiction seek a way out, but the solutions are not readily available or accessible. Here is where online Suboxone doctors come in to help make sobriety easier. Suboxone treatment is the most efficient in managing opioid use disorder. It is a way to get clean and stay clean that has been around for a while, is affordable, and is easy to access with online Suboxone doctors. If you want an opioid addiction treatment option to help you succeed in your recovery journey, watch on to learn more about Suboxone. Suboxone is the leading medication-assisted treatment, or MAT, for opioid dependence or addiction treatment for opioid use. It incorporates using behavioral therapies and counseling with Suboxone to help people wean off the adverse effects of opioids by reducing cravings and withdrawal symptoms. Suboxone is a standard treatment for opioid addiction that can work for some patients. It is one of the more accessible options for those who need it. Suboxone treatment varies for different people. Some may have different treatment plans than others. Online Suboxone doctors can help treat your condition using Suboxone for opioid use disorder. It is essential to remember MAT plans are not one-size-fits-all. Suboxone is part of a comprehensive treatment plan that implements the help of counseling and other treatment and support services. Suboxone works by reducing the reemergence of cravings and withdrawal symptoms. When you take Suboxone, its active ingredients block non-prescription and prescription opioids from binding to those receptors. It creates a perfect knockout to combat opioid withdrawal symptoms and addiction. Suboxone is available as a sublingual film or tablet that dissolves under the tongue. The sure way of getting clean is also through the help of holistic drug rehab, counseling, behavioral therapies, and the guidance of our online Suboxone doctors. Our Suboxone doctors can prescribe Suboxone and provide counseling services through video conferencing during and even after your treatment to encourage a life without drugs. The help of online mediums makes it easy for people who live in rural areas or have busy schedules to create a treatment plan that works for them. Suboxone is a combination of buprenorphine and naloxone. Buprenorphine acts as an opioid partial agonist, which activates the opioid receptors in the brain, but with lesser effects. It does not create a high that is often associated with opioids. Naloxone, on the other hand, is an opioid antagonist which blocks the effects of other opioids. It reverses opioid effects further to prevent the reemergence of cravings and withdrawal symptoms. A few doses of buprenorphine replace the euphoric feeling of opioids without harmful consequences, while naloxone prevents opioids from taking effect. The combination of buprenorphine and naloxone causes a person to feel like they are not taking any medication. Suboxone is a prescription medication from a licensed Suboxone doctor. With the help of telemedicine, the online Suboxone doctor can help provide an online prescription for Suboxone anytime and anywhere. The online Suboxone doctor will also guide you in taking Suboxone correctly and ensure your treatment goes off without a hitch. You should always follow instructions as prescribed by your doctor when taking Suboxone. Taking medication is a suitable pathway for your new way of life. However, medication misuse can lead to a few harmful side effects. Suboxone is not an over-the-counter treatment. You must check your online Suboxone doctor before deciding to avoid derailing your steady progress and sobriety. We advise you always to research and assess with your Suboxone doctor what kind of treatment plan is ideal for your needs. Suboxone is taken as a sublingual tablet or film that dissolves under the tongue. It is taken orally and should not be injected, chewed, or swallowed whole. When you take Suboxone, you should follow the directions of your online Suboxone doctor. You must avoid drinking alcohol while taking Suboxone as it can increase the risk of side effects, as with most medications. The medicine may take up to 15 minutes to take effect and can last up to 24 hours. It is crucial to note that this medication may have side effects, but it should not be a huge concern as your online Suboxone doctor will help monitor you. Some of the most common side effects of Suboxone are drowsiness, nausea, headache, constipation, dry mouth, and sweating. These side effects are usually mild and go away on their own. However, if they continue for more than a few days, contact your online Suboxone doctor. Suboxone should not be used if you are allergic to buprenorphine or naloxone. You should also not use Suboxone if you have recently used alcohol, sedatives, tranquilizers, and other drugs, such as benzodiazepines like Xanax, lorazepam, and Restoril. If you are currently taking these medications, contact your Suboxone doctor for alternative medicines. Combining other medications with Suboxone may result in serious side effects. You must always consult with a Suboxone doctor before taking Suboxone for your treatment. If you're taking certain medications, ask your licensed healthcare provider for the best course of action. Avoid using Suboxone and consult your online Suboxone doctor for alternative treatment if you are pregnant. It can be very tempting to jump into treatment, but it is also crucial to find out what you should expect from entering this form of treatment and what to expect from a drug detox. Suboxone can interact with other drugs and medications, so it is important to tell your online Suboxone doctor about any other medicines or supplements you are taking. Suboxone treatment is not just something you take once a day, but a continuous process to get you back on your feet as soon as possible. These processes can be anything from online meetings with your Suboxone doctor to blogs or articles you read online. It is also essential to know that some of the side effects while taking Suboxone can make it difficult to concentrate or think clearly. The most practical choice for those who need help in battling opioid addiction is Suboxone treatment. It is not only crucial to have an online Suboxone doctor to help guide you through the process, but also to be open-minded about the whole experience. It takes a lot of strength and courage to seek help and know that every day is an opportunity to change and achieve sobriety. At SuboxoneDoctor.com, we believe that the first step to your sobriety is working with our licensed Suboxone doctors and the combating aid of Suboxone for opioid use disorder. Our online Suboxone doctors are here to help you with every step and the resources and support needed to succeed in your sobriety journey. Visit SuboxoneDoctor.com today to begin your road to recovery.